Hi, I'm Raina Morgan with iHealthTube, visiting with Dr. Aaron Katz, who wrote Prostate Health. And we're talking about all the ins and outs and symptoms of prostate cancer and preconditions. And one of them you talk about in your book is called PIN. That's not cancer, right? But it is a red flag?
That's correct. It is a red flag. And I think that men need to understand that PIN is a condition that is detected on a prostate biopsy. So who needs a prostate biopsy? If a man comes in and he has a persistently elevated PSA, then he needs to undergo an ultrasound of the prostate. And at the time of the ultrasound, biopsies or small pieces of the prostate can be taken for an analysis. And if the biopsy comes back, it will come back with either one of three types of conditions. There'll either be no cancer or benign prostate condition. There'll be cancer, and then there'll be this pre-cancerous condition. There could be this pre-cancerous condition.
And that's what PIN is?
Called PIN.
Okay.
That's correct. And there is some debate in the literature as to how many of the men who have PIN will develop cancer and how long will it take for them to develop cancer. But the consensus is right now that men that have a few cores of PIN on their biopsy probably need to have another biopsy, usually within 6 months to a year, because those men have the highest rate of developing prostate cancer in that small period of time. What we believe right now in prostate cancer biology is that there is a cascade of events that occur. Genetic changes can occur in the prostate, changing the prostate epithelium or the lining of the prostate from normal to PIN to cancer. And why those changes occur are completely, for the most part, unknown. We have certain hypotheses that it can be related to diet, it can be related to the environment, which we can't always control, but there are certain things within the environment, within the diet, that we can reduce or add to our diet to prevent that cascade from occurring. Can we block inflammation, which would block that PIN development and block that cancer development?
So those are the vital questions you ask at that stage, and sometimes it could still at that point be lifestyle changes?
Yes, lifestyle modifications, reducing red meats in the diet, reducing fats in the diet, incorporating some of the nutrients that we're studying at the center, some of the important compounds that can interfere with inflammation in the body and in the prostate and potentially block the development of advanced prostate cancer.
So some of the natural remedies that you talk about in your book could be introduced at this phase?
Yes.
They could
yes,
be.
And in fact, we're just completing our phase 1 clinical trial using a novel herbal compound. There's a compound called Zyflamend, which we're testing on just those patients that have been diagnosed with PIN, and we're treating them for 18 months, and we're trying to block advanced and aggressive cancers in those men. And that is in fact what we're finding from our results on our Zyflamend trial.
Very good. Well, thank you for that information, Dr. Katz.
Thank you.